Hi, I've previously shared my experiences of navigating the health and care system for my son with complex health needs, both from the carer perspective and that of the importance of effective sharing of patient data. Today, I've been invited to think about my son's care in terms of secure data environments. So before I begin to consider this, I would just like to share one slide with you, which defines the concept of a secure data environment and captures a couple of thoughts around sharing information. So the Secure Data Environment Service provides approved users with timely and secure access to health and care data. And to borrow a quote made by Professor Sir Chris Whitty, the hope is that this would allow the effective dissemination of research findings to the people who can make use of them to maximise the benefit of the research without delay. But how can this be achieved whilst maintaining public and patient trust? Research conducted by the University of Geneva, presenting citizens' views on sharing their health data, found that being perceived as professionally competent, generating public good, and being under effective governance translates into trustworthiness. So I'd like you to hold these thoughts in your mind whilst I share my story with you. So, thinking of a secure data environment, I'd like to explore if open and transparent access to patient information could have helped my son, which sharing his complex history provide valuable information to help future patients. To do this, I'm going to share some very honest accounts of our difficult journey and ask you to consider the impact information sharing, or lack thereof, had on my son's diagnosis, his childhood, and on our family life. I'd like you to think back to April 2020, a week into the first national lockdown. Shock, disbelief, denial, panic, fear, and finally, reluctant acceptance. I'm sure that we could all identify with one or more of these emotions. The world as we knew it stopped turning with no warning. How were we supposed to feel? I listened, as we all did, to the unfolding horror of the COVID pandemic and heard the words lockdown, and I felt panic. I'd been here before. I was thrown back 5 years to a moment in my family's life when everything changed forever. September 2015, the final year of junior school for my 10-year-old son. Week 1. He's looking forward to his final year and moving on with his friends to big school. Week 2. He freaks out in the classroom and remains so agitated that he's admitted to hospital. He is sedated, anaesthetised, and undergoes tests for physical and organic brain damage. A week later, we are told that he has suffered a catastrophic mental breakdown. A month later, we are told that he has severe Tourette syndrome and will never return to mainstream education. My son became a prisoner to his anxiety in a self-imposed lockdown. Unlike the national lockdown, however, life continued for those around him. My son and I were cocooned in a virtual safe world to enable his jarred mind to rest and recover. He was my constant companion, and his emotional well-being depended on mine. He needed to borrow from my reserves to enable him to step back out into the real world from which he was hiding. A world that knew nothing of the battles, the scars, the healing, and the courage needed to do this. My son's medical history is complicated and confusing. In the years leading up to his breakdown, he was referred to specialists for many seemingly unrelated medical conditions. These included allergies, anaphylaxis, problems swallowing, joint problems, visual problems, sleep problems, tics, anxiety, etc. He was described by teachers as quirky and assessed as having a specific learning difficulty. His anxiety became difficult to manage, But when I reached out for help, I was dismissed as a mother or worrier and told, he's fine at school, the problems must be at home. Following his breakdown, I was told that my young son's vast medical history had been a child's way of reaching out for help, and that, despite my best efforts, he had been let down by the professionals. No one had looked at the bigger picture and made the important connections needed for a correct diagnosis. The CAM psychiatrist initially diagnosed Tourette's syndrome, telling us, in my 10-year-old son's hearing, that he would have to be medicated as it was the worst case he'd ever seen, and sending us on our way without even as much as an information leaflet. My son was referred to the National Tic and Movement Disorder Clinic at St George's Hospital, where he was seen by a world expert in tic disorders. In her opinion, it was unbelievable that he had not been identified as being at substantial risk of mental ill health and in need of support. My son was eventually diagnosed as having a complex neurodevelopmental delay disorder, and he attended a specialist school on a part-time basis, where he received all his therapeutic support. Once again, it fell on me to provide all the background information and keep the records up to date. On several occasions, I tried to organise direct communications between the education, therapy, and health professionals supporting my son. I was told that was not possible. In terms of sharing patient information, I keep electronic and paper files to store his records, and I send paper copies in advance of hospital appointments to avoid repeating the difficult history and to make the most of our short appointment times. When he was seen at St George's Hospital, their consultation notes were lost and the digital record accidentally deleted, so that our CAM psychiatrist did not receive the report for over 3 months, and upon finally reading it, he dismissed their opinions as the usual hospital consultant fancy jargon. In terms of disease management, I met many inspirational families who shared similar treatments and therapy experiences, and it seemed to me that we were all reinventing our own wheel, as it were, and trying to help our children. Could open and transparent access to patient data have helped my son? And could sharing his complex medical history within a secure data environment provide valuable information to help future patients? With his encyclopedic history of health and learning challenges spanning the entire decade of his life, from anaphylaxis at 6 months to a mental breakdown at 10 years, surely there must have been clues to make those missed connections and to warn of his vulnerability. Clinically, there were interesting aspects such as my son's severe allergies and string of serious strep infections in the months preceding his sudden acute onset of neuropsychiatric symptoms. As a research neuroscientist, I trawled the literature, desperately looking for anything which would help my son. I remember asking our psychiatrist to consider PANDAS, which is Pediatric Autoimmune Neuropsychiatric Disorder associated with strep, and was told that it wasn't recognised at the time by NICE, and besides, we're dealing with the fallout and not the cause. It is interesting to note that 8 years and a pandemic later, the link between infections and neurological and psychiatric symptoms is very much talked about and accepted. If this was the cause, then there were different treatment options, and maybe my son would not still be on a cocktail of neuropsychiatric medication 8 years on. Learning opportunities must be taken, and there must be a means of researchers being able to access data sets to help to make these links more quickly and more robustly in the future. Finally, I was told more than once on this long journey that my son was lucky to have his mum advocating and battling on his behalf. But a child's future shouldn't be a lottery. Every one of them deserves the same chances in life, regardless of the army they have fighting for them. My impression on our journey was of a healthcare system working in silos, and I would hope that sharing information and experiences in a cooperative and transparent approach would improve diagnosis, treatment, patient care, and ultimately the lives of families like ours. Thank you for listening.